An infant in Ontario who was born prematurely and with measles has died. It marks the province's first recorded death since it declared the beginning of a measles outbreak last October. For more on this story, we're joined now by Jennifer Yoon in Toronto. Jennifer, what more do we know so far?
So we know that this was an infant, a very small infant, premature, was born and was infected with measles in the mother's womb. And we know that this was something that public health officials were kind of bracing for. And the reason for that is because measles kills between 1 to 3 per every 1,000 case. And right now across Canada, we're looking at almost 3,000 cases. So statistically, it was about time that public health authorities were thinking that we might, unfortunately, very tragically, be seeing some deaths. And this is one example. Now, we should be clear. Public health officials say that the infant died with measles, but there could have been other complications, that the infant also had issues and complications that were not related to the virus.
Jennifer, do we know about the mother's vaccination status?
Yeah, and that's important to know because all this is preventable, right? We got rid of measles, we eliminated it in Canada through vaccination. And Dr. Kieran Moore, the top doctor here in Ontario, did say that the mother had not received a measles, mumps, and rubella vaccine, the MMR shot. We also know, Sarah, that officials have been really working hard to try and convince people who are hesitant to go and get that protection because there is no cure for measles. If you get it, there's only supportive care that doctors can really give you. And I want you to listen to the Minister of Health here in Ontario about some of those efforts and what it's like to see this disease come back despite it being preventable.
It's devastating when you hear about something that we've had measles vaccine in Canada and around the world for almost 5 decades. And yet we still have individuals who, for many different reasons, are choosing not to get vaccinated. Our multi-million-dollar social media campaign is that reminder to people of the importance and, frankly, the risks of not getting a vaccine.
And dealing with that vaccine hesitancy is so difficult because there's such a wide range of reasons why people might be hesitant to get the jab. And I was in southwestern Ontario today, in fact, talking to some of the doctors treating some of the worst cases of measles in the province and also trying to convince those who are hesitant. And they tell me it's really not easy.
Jennifer, you touched on this, but what's the latest on the outbreak numbers in Ontario?
Yeah, Ontario continues to be the epicenter of the measles spread across Canada. We're talking about pockets of the province with under or unvaccinated communities super susceptible to this highly contagious disease. It's the most contagious disease known to humankind. We're at around 2,000 cases, over 2,000 cases in Ontario. That's more than the entire U.S. combined. And as I said earlier, there are other parts of the country dealing with cases. Alberta is one of them, less than half the population of Ontario, and we're talking hundreds of cases there. A situation in Manitoba, Saskatchewan are also concerning as cases climb there as well.
Thanks, Jennifer.
You're welcome.
Okay, now I want to bring in Dr. Samir Gupta to talk more about this case. He's a respirologist joining us now from Toronto. Dr. Gupta, good to talk to you. It's a very sad story here, though, that we're talking about. How does a baby contract measles before it's even born?
It's a great question, Sarah. You know, we heard from Jennifer about this being such a contagious virus, and it's very contagious through the air. But as it turns out, it's also contagious through the blood. So we call that vertical transmission, when infections pass from the mother through the placenta to the baby. And unfortunately, measles is one of these viruses that does that quite effectively. And so you call that congenital measles, so measles that the baby is basically born with. And so if you think about that pregnancy state, it's sort of, there are two levels of concern there. One is pregnant women in general are more susceptible to having severe outcomes from measles. And we've talked about pregnant women being more susceptible to severe COVID disease. There are many different things happening in pregnancy with the immune system so that there's more susceptibility. In measles, there's higher susceptibility to pneumonia, to encephalitis, and to death. So if the mother is sick, obviously not good for the baby. But then there's this direct risk where if the mother gets the virus, it can be passed on. And obviously the baby is very susceptible. And we see all sorts of things. We see premature birth, as was the case here from what we're hearing. We see smaller birth weights. We see miscarriages. We see premature death in utero, even before the baby's born. And then we see in babies who are born with it, more complications, unfortunately, things like pneumonia, things like encephalitis. And ultimately, we also see a higher rate of death in those very vulnerable infants who have measles.
Dr. Gupta, where are we at in terms of this particular outbreak?
Yeah, it's like what you heard. It's, particularly in Ontario and southwestern Ontario, we are kind of at 100 times what we typically see. We might see 20 cases in this province a year, exclusively people who travel to other parts of the world that still have measles. And, millions of people get this virus around the world, but it hasn't been endemic in our part of the world because we've had such an effective vaccine campaign up to recently when people were still getting their vaccines consistently. So we would see 20 cases, and now we're seeing 2,000 just since October. 140 of those people have been hospitalized. 7%. That is not a small number. That is not a rare event. Over 100 of those people were children who were hospitalized. And this is not the first case of a pregnant person getting measles. I think we've had 39, and we've had 6 cases of congenital measles already. So, this is such a sad event, but it just drives home the point. This risk is real. This is something that we really all have to take so seriously.
Given the risk that you're talking about here, particularly to women who are pregnant, is it safe for a woman who is pregnant to have a vaccination for measles, especially if they're worried about their baby and perhaps the woman has not had this kind of vaccination before? And then we ask, if they are concerned, if it's somebody we're talking about who has some hesitancy around vaccination, but is hearing this and says, I would like to get just the measles vaccine, but I don't want to have the MMR, the grouping of other vaccines as well. Is that even possible?
Yeah, so unfortunately, this is MMR, MMRV, that's how it's packaged. That vaccine is what's called a live attenuated virus vaccine. So there's live virus in there. It's attenuated or weakened so that it doesn't cause disease, but it triggers that immune response so you become immune. Unfortunately, we don't offer those vaccines to pregnant women because we know that the fetus is very susceptible. So there's this theoretical risk that the live attenuated virus vaccine can actually harm the fetus. So unfortunately, if you are pregnant, it's too late to get this vaccine. It has to be done before pregnancy. And that's why there's such a push, particularly in people who are thinking about conceiving, to make sure they're fully vaccinated before that, because it can't be done. This particular vaccine can't be done during pregnancy. If you do have exposure to measles during pregnancy, you can get something called IVIG, which is a type of immunoglobulins or immune therapy to help reduce your risk, but you can't get the vaccine. And to people out there who, non-pregnant people who want this vaccine, you sort of asked about, can they get just the measles part of it? Theoretically, yes, there is what's called a monovalent measles vaccine. It's approved in Canada. It's found in some parts of the world. My guess is it'd be very hard to find here because every province has a vaccine schedule that is composed of MMR or MMRV, which is the combination of those vaccines for mumps, measles, rubella, and plus or minus varicella. So all very safe, and that combination has been shown to be very safe. And again, measles vaccine, as you heard, 50 plus years of experience, billions of people have had it over that period of time. Extremely safe vaccine, extremely effective vaccine as well, Sarah.
Respirologist Dr. Samir Gupta, always a pleasure to talk to you. Thanks so much.
Yeah, my pleasure.